Welcome to This Explainer. Today, we're diving into a super common, yet kind of rarely discussed issue that affects so many older adults, geriatric constipation. It's a condition that impacts literally millions of people and can really degrade someone's quality of life. But because it's surrounded by so much stigma and misinformation, a lot of folks just suffer in silence. Well, not today. We're going to strip away the guesswork, look straight at the clinical evidence, and figure out exactly how our digestive system changes as we age, and more importantly, how we can actually manage it. So here's our roadmap for today. We're going to start by defining the problem, then uncover some hidden culprits, explore the moisture connection, look at effective home remedies, and finally wrap up with medical interventions. Let's jump right in.
Section 1. Defining the problem. Let's look at the scope and scale of what we're dealing with here.
Okay, check this out. While about 20% of the general U.S. population deals with constipation, that number jumps to nearly 30% in older adults. But here is the truly staggering figure. In long-term care settings, the prevalence can actually top 50%. That's half the people there. It's a massive systemic issue. And beyond the sheer physical discomfort, which is bad enough, right? It carries a really heavy economic burden. According to clinical reviews, managing chronic constipation and the complications that come with it can cost up to $12,000 a year per patient. Just let that sink in. Let's bust a huge myth right off the bat. You absolutely do not have to go every single day to be considered healthy and regular. Seriously, this is such a massive misconception, and it causes so much unnecessary anxiety, not to mention the overuse of really harsh laxatives. Human bodies are all incredibly different. In the clinical reality, going up to 3 days without a bowel movement can be perfectly regular for some people, so you can officially take that daily pressure off yourself. Actually, if you look at the Mayo Clinic, they define a clinical concern as passing fewer than 3 stools a week or experiencing severe difficulty in straining when you do go. It's really about the quality of the movement. The actual clinical diagnosis hinges on things like incomplete elimination or really hard, difficult-to-pass stools, rather than just some arbitrary daily checklist. All right, Section 2, Hidden Culprits. Let's talk about diets and medications. We usually think we know exactly what causes a backup, right? But honestly, there are some pretty surprising dietary triggers out there. We know foods that lack fiber, like white rice, refined grains, cheese, and high-fat meats, can slow down your digestive tract. But get this, everyday items like unripe bananas, tea, and yes, sadly, even chocolate, can act as constipating agents too. I know it's a bummer. If you or an aging loved one are struggling with regularity, doing a quick audit of these specific foods in your daily routine is an absolutely critical first step. Now, beyond food, we really have to take a look inside the medicine cabinet. When doctors evaluate older patients, they always check for what's called secondary constipation. Basically, this means the backup is a direct side effect of a medication. Some of the biggest offenders? Pain meds like opiates, antidepressants, your everyday antihistamines, antacids that contain aluminum or calcium, and even iron supplements. The key takeaway here is that for a lot of older adults, constipation isn't some personal failing or just a bad diet. It's literally a mechanical side effect of the very medications that are keeping them healthy.
Moving on to Section 3, the moisture connection, hydration and health.
Before we look at the numbers, we need to clarify what scientists actually mean when they say moisture intake. Because guess what? It isn't just about forcing down 8 huge glasses of plain water every day. In fact, doing that can actually be pretty dangerous for patients with conditions like congestive heart failure. Moisture intake actually covers all the hidden water in the foods you eat, think fruits and veggies, plus all the other beverages you drink throughout the day. This data is fascinating. There is an incredibly clear relationship here between your total moisture intake and bowel health. Researchers took 14,000 participants and divided them into 4 groups, or quartiles, based on how much moisture they consumed. And the results? Compared to folks in the lowest intake group, those in the highest quadrile literally had their risk of constipation nearly cut in half. It's represented by an odds ratio of 0.54. Simply put, the more moisture you have in your total diet, the softer the stool becomes and the easier it mechanically passes through the digestive tract. It's a real game changer. All right, Section 4, effective home remedies. Let's talk actionable habits. Establishing the perfect bathroom routine is absolutely foundational. You really want to capitalize on your body's natural rhythms. That means trying to go first thing in the morning or maybe 30 to 60 minutes after a meal when your digestive reflexes are the most active. Next, you got to mechanically align your body. Using a small footstool to elevate your knees above your hips actually changes the angle of the rectum. It physically makes it so much easier to pass stool. And finally, just give yourself time. Allow about 10 minutes of completely unhurried, private time without rushing. Now, from a dietary perspective, clinical guidelines strongly recommend getting about 20 to 35 grams of fiber every single day. You can easily get this through foods like beans, whole grains, especially bran, and fresh or dried fruits like apples and apricots. But hey, if dietary changes alone aren't quite cutting it, adding a daily soluble fiber supplement is super effective. And the really good news? Modern supplements dissolve completely in liquids without leaving any of that awful, chalky grip behind, which makes them so much easier for older adults to actually enjoy.
And finally, Section 5, Medical Interventions. What do the clinical guidelines say?
We're anchoring our medical advice today in a really comprehensive clinical review published in the HCA Healthcare Journal of Medicine. Doing this ensures we're looking at the absolute most current best practices for older adults because let's face it, treatment in this population requires a very careful, specialized approach. Okay, understanding exactly how long different treatments take to work is absolutely critical. If you use the wrong tool at the wrong time, it just leads to frustration and sometimes worse. For instance, bulk laxatives, which are basically just fiber supplements, can take anywhere from 36 to 48 hours to kick in. They're more of a long-term strategy. Osmotic laxatives work by pulling water into the intestines to soften things up, and those usually take a couple of days. On the flip side, stimulant laxatives act as a much faster rescue therapy. They kick in within 6 to 12 hours by directly triggering intestinal muscle contractions. So, the huge takeaway here is knowing the difference between what doctors actually recommend today versus those outdated home remedies we all grew up hearing about. Current clinical guidelines heavily favor osmotic laxatives and bulking laxatives, like psyllium, as super safe first-line treatments. On the flip side, they strongly advise against older treatments like docusate. Why? Because multiple studies have shown it literally has no proven benefit over a placebo. Even more importantly, doctors strictly warn against using mineral oil as a laxative for seniors. It carries a very severe risk of aspiration pneumonia, and it was actually recently added to the list of medications that older adults should actively avoid.
Now, while constipation is incredibly common and usually harmless, it should absolutely never be ignored if it shows up with certain red flag symptoms. If you or someone you love experiences any rectal bleeding, an inability to pass gas, persistent pain in the abdomen or lower back, or unexplained weight loss, or if you have a family history of colon cancer, you need to seek a medical evaluation right away. These things can be signs of strictures, tumors, or severe bowel obstructions that require immediate medical attention. Better safe than sorry, for sure. As we wrap up this explainer, I want to leave you with one final thought. We've seen just how powerful simple things, like fixing your bathroom posture and increasing your moisture intake, can really be. So, based on all the clinical evidence we've just unpacked together, what is one simple change you can make today to proactively protect your digestive health, or maybe the health of an aging loved one? Remember, small, consistent adjustments are often the secret to profound improvements in our everyday comfort. Thanks so much for joining me on this deep dive.